Good afternoon, everyone, and a very warm welcome to UNGCNI's Global Roundtable on ensuring healthy lives and promote well-being for all at all ages. This roundtable is being held in partnership with Legato Health Technologies. Ensuring healthy lives and promoting well-being is essential to achieving the Sustainable Development Goals in this decade of action. Businesses have become a critical partner in designing and delivering effective, scalable, and practical solutions for healthcare to the last mile. The presence of eminent global business leaders and practitioners today at this roundtable bears testimony to this fact. We are thankful to all speakers and the moderators for taking out time from their busy schedule and agreeing to share their insights and solutions on how healthcare can be promoted for all. Without further ado, I invite Mr. Ratnesh, Executive Director, UN Global Compact Network India, to deliver the welcome address. Over to you, sir.
Thank you. Thank you, Shreya. A very warm welcome to all of you. I am told that there are more than 450 registrations for this very interesting and very critical topic that faces us in the post-COVID world. And it's also part of the Sustainable Development Goals, as well as our 10 principles of which UNGCNI promotes among businesses. So basically, health is the center. And a little bit about my background. I have joined recently, but I am mainly a financial sector, inclusive finance, inclusive growth expert. And in my 3 decades of working with the grassroots agencies, institutions, I have found that health is the key determinant of whether you remain out of poverty or you don't fall back into poverty. So basically, we cannot fail. I mean, businesses, governments, civil society, everyone together have to work out that we ensure healthy lives and promote well-being. And it is also linked to the other SDGs in terms of not only poverty, hunger, but also inclusive industrialization, infrastructure, saving the environment. Everything is linked. If the person is healthy and if the person is able-bodied, then it goes on to promote all kinds of positive externalities. So given the importance of this subject, I think it could not have been held at a more appropriate time. And as I shared with you that in my own personal journey, I have found that health is the most critical supportive variable in all that we do or aim to achieve. Next on, I have to thank each one of you, I mean, especially Legato Health Technologies, who have been very consistent and very supportive of this idea right from day one. And its representative, the country head is going to provide his special address. So we are all waiting what perspectives he shares with us. Dr. Sunita Maheshwari is there, whose name is very well known for the innovative tele-radiation innovations in that area, and also in support of people who are stuck with issues which in remote areas. So we would be very happy to hear from her as well. And Deepak ji, ultimately at the end of everything, behind everything, we need finance, we need scalable solutions to be done by startups. And you are working tirelessly to make this ecosystem work, to make this ecosystem achieve what it is intended to achieve. So I think the inaugural session is packed with 3 doers, and I won't stand between them and you. So with a very warm welcome to all the participants who have registered today for this important topic, I request Shreya to initiate the first session.
Thank you so much, Mr. Ratnesh, for sharing your thoughts with us. We couldn't agree more that health is actually the connecting or the binding factor amongst all the SDGs. If their good health is required for every other SDG to be achieved. Now, I invite Mr. Sai Shekhar, Country Head, Legato Health Technologies, to deliver the special address. Mr. Saishika, you're on mute.
All right, are you able to hear me?
Yes, perfect.
Okay, so I was saying thank you and thanks for the warm welcome. And it is great to be part of this esteemed group. And big thanks to UNGCNI for the invitation and really the opportunity to address and engage with this fantastic group. So thank you. As an organization, we are very happy, extremely happy to partner with UNGCNI for this roundtable, and I definitely hope that it goes beyond this roundtable as well. And as Mr. Ratnesh said, health and well-being is a topic that is very close to our heart, right? It's our organization's core purpose, which is improving the health and humanity and focus on whole health. That's what we do. That's what Elevance Health stands for, and that's what Legato stands for. Before I start, let me just touch on who is Legato Health Technologies. Legato is the Global Capability Center, and I can also say that it's the fastest growing global capability center within India. We started at the end of 2017, and really the operations began in early 2018, which means that we are here for about 4.5 years or so. We are a 100% subsidiary of Elevance Health, a US Fortune 20 enterprise. We provide anything from a business, operations, IT, clinical, and solutions to Elevance Health, but also to non-Anthem Blues, as we call it, the US healthcare industry itself from India. Legato globally is about 25,000 employees, and we have presence in 3 different countries today: India, Philippines, and Ireland. In Legato, India itself is about 18,000 spread across 3 different cities: Bangalore, Hyderabad, and Gurugram. So we are large, we are fastest growing, and we are really here to make a difference. Let me just say that all of our lives, and every one of you would agree that it has changed in the last 2 years with the advent of COVID. Okay? Nothing has changed us so much, really, in the decade or 4 decades that have been in the workspace, that COVID has really changed us. It has really made us think differently. It has made us have a focus, a renewed focus, and a serious discussion about health and wellness in every corner. COVID was sudden and it was unexpected. And really, I think there's a lot of positives from COVID, even though there's a lot of negatives as well. I think it has led to an unprecedented leap in digital adoption, and that to globally adapt that, as well as move forward with tangible actions, not only in containing the spread, but also how do we leverage the data and how do we provide solutions across the globe. And that's very important. Work is not local, work is not contained to a city or a country. It has been a global, and there is a demonstration of a sense of urgency, care, resilience, and agility. Probably we all inherently had it, but COVID triggered it much faster. And it is really commendable that the entire healthcare ecosystem has come together, not only in quickly adapting, but also collaborating across technology partners, governments, in developing apps and solutions to contain the virus, track the vaccine productions, distribution, and really make the services accessible virtually. And this cannot be more pronounced in India than in any other place. Scale, scope, complexity of monitoring, administering the vaccine, and tracking the progress would not have been possible without the technology. And I really applaud the government for really creating the COVID app, but also the websites that really track the progress, right? I think embracing technology with that openness probably has never happened before, but this is a great start in terms of making sure that we do that. It is with awe that I commend the work of doctors, nurses, hospitals, governments, and technology experts who have all come together in finding that swift resolution to COVID. And really in the wave 2, many of them have worked tirelessly in supporting the sick and providing care. And probably never the world has come together in recent times on such massive scale to address just one single issue, which is COVID, tackling COVID. Now, having said all of that, we all know that there is a huge gap in accessing healthcare, not just in India, but globally as well. This is where SDG 3 becomes extremely important. We all know that a large section of the population is still waiting for COVID-19 vaccination. Vaccination is available in developed countries and even in developing countries, but when you go to the low-income countries, neither the vaccination is available nor the choices are available. And that can be extended for other diseases as well. If we look at infant mortality or maternity care, or even quality healthcare access, doctors and medicines are still a challenge in many places in India and globally as well. And that really, I think, brings the drivers of change for us. And really collectively, we can make an integrated approach in fulfilling SDG 3. So great effort from UNGC&I, and we're all very happy to partner with UNGC&I in accomplishing that. Last two words from me in terms of the Elevance Health, our parent company, as well as Legato and what we do in progressing SDG 3. Elevance Health parent company has prioritized 7 SDGs at the group level, of which SDG 3 is the most important one for us. That's because first of all, it's in the healthcare space and it directly impacts our business and what we do and how we impact communities, and also from a larger purpose of improving the health of humanity. In 2021 alone, 60% of Elevance healthcare spending was in value-based care. This is about improving the health outcomes and reducing the cost of care. Now, Legato, for its part, we take forward what the parent company's ideology is in doing the same from an India perspective. And we are doing many things, but I will highlight 3 or 4 of them. First of all, we are a leading healthcare technology player. We are leveraging the power of technology, innovation to design best-in-class solutions globally. Okay, that's what we do. Number 2, I think it starts with really caring for our own people. Okay, taking care of our own people is a priority, which is our employees. Providing a holistic healthcare and wellness options and solutions is the starting point for us. Really beyond that, I think even providing large-scale screens in the office for reducing stress, wellness-friendly workspaces, that is state-of-the-art air quality, ergonomic workstations, and the workstation that I'm working, I can stand up and work. I can also sit and work, and so on and so forth, and healthy food options. These are just a few that I'm highlighting. But the more importantly, I think the more one which really makes a difference is to really engage with multiple vendors that focuses on mental and emotional well-being programs as well. That is very important for us. And then taking that step further, extending our initiatives to our support staff. Support staff are really an extension of our own employees. So making sure that they get the health benefits as well as free vaccination for themselves and their families was very important for us. The third one is deserving communities, right? What do we do from a corporate social responsibility was very important. During the second wave of COVID, in partnership with Elevance Health, we funded ICU beds at a leading hospital in Bangalore. We also funded COVID care centers in partnership with United Way International in Hyderabad. We are now really partnering with startup organizations, both to develop innovative solutions in healthcare space and also to offer best-in-class healthcare for our solutions for our associates and the communities where we live and work. This is an ongoing journey. I think we are well aligned with the purpose of improving the health of humanity and the SDG 3. We are very happy to be here and partner with UNGC&I today. We will continue to operate in the healthcare space, specializing in tech-driven solutions. We'll continue to focus on providing the advanced leading-edge health and wellness solutions for our associates. And we will also look at innovative organizations where we can partner with in developing best-in-class solutions. So thank you again for the great opportunity for engaging the corporate sector and bringing the government industry bodies together to collaborate and co-create solutions for the healthcare industry. Thank you. Really happy to be here.
Thank you so much, Mr. Sai Shekhar, for sharing these very important insights with us, and also for stressing the fact that it's through collective action that we can address these complex healthcare requirements in the country. Thank you once again. Now I invite Dr. Sunita Maheshwari, co-founder, Telradsol, to deliver the keynote address. Over to you, Dr. Maheshwari.
Thank you very much, and lovely to be here. Thank you, GCI. And I'll take off from what Mr. Krishnamurthy was talking about, which was access, and how do we increase access to medical care. So I'll focus really on access to doctors, because being a doctor myself and having worked in the space of tele the last 20 years, when we started teleradiology 20 years ago, we were primarily covering American hospitals from India. And we did that for 10 years and started then working with Singapore. But all along asked the question that what are we doing within India? How can we use the same technology of teleradiology to really help remote parts of the country get a good diagnosis? Because as one knows, without a good diagnosis, you can't really even move on to treatment. And getting that diagnosis out to rural and remote areas is a challenge. So in the last 7-8 years, as bandwidth penetrated into India, as the kind of internet became much easier, so you could send images across the country, teleradiology in India started exploding. And it really led to an increase in usage of CT scans and MRs and X-rays and diagnosis. For instance, we cover Ramakrishna Mission Hospital in Arunachal Pradesh. They had a CT scan and an MRI gifted by the Prime Minister of India, but there was no radiologist there to actually do the reporting. So it wasn't being used. So teleradiology within the country then enabled these technologies to actually get used to the maximum. Now, once you have a diagnosis or once you have a patient who needs a doctor, the next thing is, where do I get this doctor? I think the good news is that the number of doctors in India has increased. I'm sure Prof. Reddy has the statistics, but the number of medical schools are now hitting almost 500. We have more doctors coming out. The doctor-patient ratio is improving. The bad news is the urban-rural divide persists. So we still have a 3.8:1 ratio between doctors in urban areas versus doctors in rural areas. And it is a lifestyle choice. It's whether the doctor wants to go back there or not. And while we can't pull them, forever, the government has been trying to make mandatory rural service a part of medical training. But one technology solution that can help, and one technology solution that got fast-tracked like the vaccines did during COVID, was really telemedicine. And I think it took a pandemic for telemedicine to get legalized in our country. I don't know how many of you are aware, but before 2020, it was not legal to practice telemedicine. Teleradiology was still okay because it was considered telediagnostics, but telemedicine and teleconsultations was in a very gray zone. So the pandemic changed all that. And I think the teleconsultations, for instance, during COVID, we ran a program for the painter community in India in partnership with AkzoNobel, so about 2 lakh painters. And what was fascinating was that with one smartphone, you had the whole family of a painter being able to access a doctor. So one phone enables 5 or 7 or 10 or 15 people. It can enable a whole village to access a doctor via telemedicine. And that has been really a game changer. I want to put on record here that I've been extremely impressed with the government telemedicine program, because the eSanjeevani program, which was rolled out in the last 2 years, has 2 key things that are essential. One is the eSanjeevani OPD, which allows patient to doctor consultations. So a patient can log on, it's completely free. A patient can log on, put their details and access a doctor. And eSanjeevani is doing over 1 lakh plus consultations per day. They've done over 2.5 crore consultations, teleconsultations at last count. But the eSanjeevani also has a specialist to specialist, a doctor to doctor, which is a big issue when you're in a rural area and you've got someone with maybe a cardiac issue and you don't have a cardiologist. So to be able to access a cardiologist, get an opinion, send them an ECG and say, what should I be doing? Should I put this patient on antithrombotics or not? Getting that opinion. I think that's really been enabled today in India with the whole teleconsultation network across the country. And I think that, hopefully, even as COVID has gone, that impact of telemedicine for this country will stay, and it really has taken teleconsultations into rural areas. I think the third area where tele has made a large and hopefully lasting impact will be in mental health. And with privacy issues, most patients, even urban patients, were not seeking mental health solutions because they didn't want to be seen in a clinic talking about anxiety or depression or stress. And you've seen the statistics with 40% of Indians, depressed. There are only 10,000 psychiatrists in our country. There are only 2,000-3,000 counselors. While that number is increasing year on year, it still means that there's not enough access, because you may be in Raipur and not have a psychiatrist there. And tele-counseling and tele-psychiatry, which is now very much legalized within the country, along with e-pharmacies, allow for mental health counseling from anywhere in the country. And I think that is, again, going to be a lasting legacy, if I may call it that, of COVID. So I think I will end with that. What we've seen post-COVID is that face-to-face consultations are back. And clearly patients want to see their doctor and feel their doctor and, have that stethoscope on their chest. But teleconsultations also continue. And for especially people in remote parts of the country, rural parts, the teleconsultations are an integral part today of their existence. So I think this model of phygital, of kind of physical and digital, is the model that will work well in India. So you go see your doctor if you have one in your neighborhood. Perhaps you can then do the teleconsultation to show him your reports, so you don't have to brave, traffic, even in an urban country, or you don't have to brave water in Bangalore to get to see your doctor. So I think this kind of combination, this phygital practice of medicine is going to enable access to a lot of patients, both in urban and rural India. Thank you very much for having me, and I'm sure the rest of the deliberations will be wonderful.
Thank you so much, Dr. Maheshwari, for sharing your very valuable experiences and thoughts with us, and for highlighting as to how telehealth can bring about a revolution in healthcare deliveries and also improving access. It's really important. Access for healthcare, access to sustainability, challenges, etc. is extremely important. Thank you so much for sharing that. And now I invite our chief guest, Mr. Deepak Bagla, Managing Director and CEO, Invest India, to deliver the inaugural address. So over to you.
Thank you, Shreya. Just in time, I just made it out of my locked office into another stable place where I can address and be with you. But thank you really for getting us together. And Ratnesh, really, thank you to your team for organizing this. Very important. And it was a pleasure hearing Sai and Dr. Maheshwari both on how this little virus has changed our lives completely. I'll give you an example. So the World Investment Conference is happening in Geneva on the 13th and 14th of this month. And I just received the agenda last night, 105 countries. And it's a very serious conference. All these people about investment and finance, they're a very serious lot. Banking types, my types, essentially. And Sai, you are also one of those. What was interesting, which I found in the agenda this time? After every session, so there'll be a session, a panel discussion for 45 minutes. Then there was a 5-minute wellness and yoga break. After every session, a wellness and yoga break, and I asked them, can I see the agenda which happened in the last World Investment Conference? And there was none of that at all for 3 days. So here on the day itself, you have at least 4 wellness and yoga breaks for 5 minutes to 10 minutes each. So the world has changed completely. The subject which you discussed today is not just central, but it has just taken over everything. And I think every once in a while, nature comes back to remind you that this is what is core to our existence. It was very interesting hearing Dr. Maheshwari on the entire digitization and its impact. I'll tell you what. So first is, as the Investment Promotion and Facilitation Agency, we are a single point of contact for all the investors coming. What I was seeing of the 83.5 billion which came this year from across 57 sectors this year in the lockdown, which was in the top 3 sectors? Wellness and healthcare. It is right up there. If I look at my segment on Startup India, because we also are the ones which manage Startup India, this is the fastest growing segment in Startup India. In fact, even if you look at the number of unicorns out of the 107, you'll see that ones which are associated with digitization, fintech, and healthcare are the ones which are the highest number. And the other very interesting thing which I'm seeing, Ratnesh, is that a large number of new healthcare and wellness startups are coming from tier 2 and tier 3 cities. In fact, close to half of the new ones, 50%, close to that, are coming from tier 2, tier 3 cities. And the interesting element of these is that the solutions which they are providing are the ones which are more pertinent to 7.5 billion of the world's population and not just the top 500 million. Because it also takes into line what Dr. Maheshwari mentioned. See, the most critical thing is access and price point. And digitization has completely disrupted the business model where this was concerned earlier. You've suddenly realized you can do so much more with so much less. And I think this entire disruption first in the model is going to make it much easier with the digitization for us to be able to create that access for each and everyone. And I think that is the top priority of the government. What I'm seeing from the entire policy making. In fact, a large part of our startups, and especially the new ones, and especially the new ones which are Sonicons and Unicorns, are in the specific area of health delivery via digitization. And the most interesting element and encouraging part of that is that the level of financing which they are attracting is very high. I must also say that in these startups, you're seeing women as gender equality at a very high level in the team of these startups. So again, close to half of them, and in fact, more than half of them, have a woman at a senior position or a director in many of these startups. So 2 interesting elements, tier 2, tier 3 cities, solutions which are coming up are very, very interesting at very competitive price points, if I may say, and very easily scalable on that digitization platform. And yes, the entire Digital India mission, which if you recollect was launched in July 2015, I think has now shown that how it has been to a large extent the savior for all of us when we went through some of the worst crises we've ever thought of in our lives. And not just what we've gone through, but how it is going to define the future in every aspect of it. Healthcare, education, and even work is completely being redefined by this entire digital network, which is happening. The other interesting element I must tell you, so we also have a team now, which is working and dedicated on Heal from India and Heal by India. So I'll tell you where this came in from. We are now seeing a large number of requests, both from private entities as well as governments. And in fact, Sai, I must tell you, even from the US, we've had these requests even at the state and central state government levels and private sector on working together with them to create wellness centers. In fact, one of the biggest cities of the US has been in touch to see how we can create one of the world's largest wellness centers with India's participation with them. That is now going to take off. And why I'm bringing this to you is that this is a big opportunity for us, all because of people like you, Dr. Maheshwari, Ratnesh, and everyone, for example, who are here today, for India to establish a pole leadership position in the segment. We know our doctors are all over. We know our health providers are all over. Now with the digitization, we are setting up models which the rest of the world is looking at on that entire delivery. And now they are partnering and wanting to see how we are bringing in not just our modern base of medicines and health delivery, but also bringing in our other ancient learnings on this one together. For example, the Ministry of Ayush has now been very actively in discussions, or they have been reached out to by several governments to see how we can work together on this. So I see this movement of heal by India, which is, and heal from India, both of seeing India developing as a strong wellness destination. And already a large number of policy initiatives have happened on that one, right from the initial part of seeing how we can increase the number of visas which can be provided for this requirement, to how we can better create credibility in the training centers in India, which are right across, to how we can upscale the services, to how we can do a global outreach, and how we can partner and make it a more comprehensive package for others in the world to look at. Apart from the fact, obviously, on how we can, which we've already been doing always, supporting the world with the healthcare providers, but also how we can start increasing the number of trainings and increasing the number and the capacity of where we're doing that. So that's a big area, I must mention, of focus within the segment and where we are working very actively. One thing I must mention here, and that takes me to one of my earlier points, is to say that how this has now become one of the top areas for investment for us. The recent product-linked incentive schemes which have been announced, where we are providing fiscal incentives to corporates and to private enterprises to be in this area. I must say the two most successful ones, were the ones on pharmaceutical oblique healthcare, and the other one was on electronics, which we all know. Each and every major stakeholder in the world has applied for that. In fact, now we are getting a number of these requests, that can you please add another chapter to the PLI and get another one happening, especially in the medical and the wellness segment. The reason being that they had missed out on the earlier ones. So the positioning of India being there at that point and being able to provide quality in a scalable manner and a competitive price points, I think is now getting very firmly established. The fact now is, with all of you getting involved in it more actively, you can see it move into a position where India establishes its strength and shares it with the entire world in a much faster manner where that is happening. I do want to say one thing though, that the disruption which is taking place is now at a very rapid rate. It is managing this journey of disruption and transition, which is going to be now the biggest focal point for every one of us. These are the points where they can build the momentum and take it on to the next level, or they can start creating challenges for everyone, which become difficult to handle. And I think we are well positioned to do so, but you would require each and every stakeholder to work on it in a very concerted and a very responsible manner. So with that, let me thank you all once again. Ratnesh, you and your team, truly, I think let's follow through after the learnings which we will hear from everyone today on what we can take it on as the next action points. I would also suggest that if there's anybody who can guide us, help us at Invest India level, please do let us know. This is something which is a top priority to us, and a top priority which has been set by the highest officers in the country. So there's a lot of openness, there is a lot of willingness, and there's a lot of desire to see how we can share our learnings with the world, learn from the world, and position ourselves amongst the best in the world. Thank you.
Thank you.
Thank you so much, Mr. Bagla, for sharing your most important insights with us. especially focusing on digitalization, which can be a prime catalyst for healthcare delivery in countries like India. I'm sure a lot of other countries like India can learn from these experiences and implement them in their own countries and states. And truly, India is well positioned to become a global leader in this area. Stressing again on the fact that it is through collective action we can hope to achieve the SDGs and sustainability solutions in healthcare. Thank you once again. We now come to an end of the inaugural session. On behalf of UNGCNI, we thank our esteemed speakers, Mr. Bagla, Dr. Maheshwari, Mr. Sai Shekhar, and Mr. Ratnesh, for sharing the wealth of your experience with us and practical solutions to address the need for sustainable and robust healthcare systems. I'm sure the audience would have learned a lot from the insights and experiences you've shared with us, and thank you once again. We couldn't have asked for more. Now, we move to the panel discussions and start with session 1, role of businesses to build sustainable and resilient healthcare systems, including the supply chain. The moderator for this session is Professor K. Srinath Reddy, President, PHFI. The distinguished speakers for this session are Ms. Ameera Shah, MD, Metropolis Healthcare, Mr. Sai Shekhar, Country Head, Legato Health Technologies, Mr. Ashish Agarwal, MD, Nagaro, Mr. Vaibhav Tiwari, CEO and co-founder, Porsche, Mr. Sahil Dharia, Chief Executive and founder, Sooth Healthcare. A very warm welcome to all of you. Professor Reddy, over to you. The floor is yours.
Thank you very much. The mention has been made how COVID has given us many lessons. And one of the key lessons is that national and global economies will keep slipping on the banana skins of public health failure. And therefore, we do need to build a very strong health system. So what we need is an efficient, equitable, and empathetic health system functioning predictably and reliably in the steady state, even without a public health emergency, so that we can actually generate a strong, swift, and sustained pandemic response to counter the public health emergency. Such a system must be responsive, responsible, and resourceful. And in this, we recognize that sustainability and resilience are key ingredients, and that's why this panel becomes very important in stressing how the industry, as a very important partner, can play a role. And the fact that we need an all-of-society response, with the industry also as the key stakeholder and the participant in the providing the right kind of response, is amply clear. What we require are partnerships for a public purpose. We need to redefine PPP not as a public-private partnership, as disconnected entities, but as a synergistic response from all stakeholders working together in society for partnerships with the public purpose. And we recognize also that in this venture, in terms of ensuring sustainability and resilience, it should not only focus on operations within the industry itself, but across the entire supply chain that feeds the industry. And therefore, you can actually create and catalyze a complete chain reaction in which sustainability becomes an important element, particularly in these days when climate change has become a major global threat. And therefore, that element too needs to be taken in, not only to maintain the stability of supply chains for continuity of operations, but also to ensure that the supply chains foster sustainability all across the line. And in this, the ESG framework of environment, social, and governance norms has become very important in modern times, and industries are not only adopting it and monitoring it, but also evaluating how their performance is. And in that context, I believe it is absolutely important to relate how ESG is influencing the work of the various industries, particularly in terms of advancing health. And we will now have a conversation with 4 industry leaders in this area. So let me open with Ms. Amira Shah from Metropolis Healthcare. Ms. Shah, your organization is a leading diagnostic chain in India. You are currently working to integrate ESG strategy into your business operations. What are the key ESG areas that you intend to focus on? And how can the industry deliver a robust healthcare model using the ESG framework in an imaginative and productive manner?
Thank you, Dr. Reddy, and I couldn't agree more with you on some of the points that you made in your opening remarks. I think in the healthcare industry, I think there's a natural feeling that everyone's doing good in a way that you're taking care of patients, you're taking care of people. So I think the formal structure of ESG really hasn't penetrated into healthcare at this point yet, right? It's still a very early stage. And I think for most corporates, and I think whether in healthcare or outside healthcare, I think there are sort of 3 phases of ESG acceptance, right? I think usually, as we say, there are 7 stages of grief, but there's 3 stages of ESG acceptance. I think the first one is usually what's in it for me, and why should I do this? And the second one is usually, okay, I'll do the minimum required, a checklist required to sort of make everybody happy. And the third one, which is hopefully the one that we'll all get to, is look, how does this truly help me differentiate myself in business and also myself in life? And how can I broaden my perspective to look at not only me, my interest, my business, but community, environment. And because I'm a part of that community and part of that environment, making that better automatically helps me. And I think broadening our perspective to really look at the world and us as a part of it, and not just as us individually, I think is the journey that most corporates are going to have to make along the ESG trajectory. As I mentioned, in healthcare, it's a little bit harder because people feel anyway we are doing good. But I'm very hopeful that as the leaders in the industry start to partake in ESG and start to really structure things in a very fundamental way beyond what we do as a BAU, business as usual, this will really start to make an impact. And I think the one biggest benefit that's happening, obviously, is that investors, institutional investors globally, are now asking this. And I think as that pull is happening from global investors, it's creating that push, at least on the leaders in the country, to really say, look, how do I do this in a very structured manner? I just wanted to make a couple of points on the industry and some of the comments made by the colleagues earlier, and I'll come back to ESG. I think while healthcare in India has truly metamorphosed and gone through a lot of evolution and changes, and I'm very excited around the potential of where India can be, not only on the Indian stage, but on the global stage. I think we also have to accept that we still do not have a consistent, reassuring healthcare system in India for every patient. We do have a good system, but in many cases we don't have a good system, and that's because of the dichotomy in it is the variability. And that really comes from the fact that there is still not strong regulation in place that enforces everybody to meet the minimum standard if you want to get into the industry. So whether it is the traditional brick and mortar players who've been there for 10, 15, 20 years, or it's the newer players that have come in, more health tech, digital guys who've come in post-COVID, the reality is that today, your quality or your sense of what impact you want to make is totally dependent on your conscience. It's dependent on your own moral compass. It's not geared or linked at all to what you're enforced to do, what is a minimum standard, what is expected of you. And to me, this is the biggest risk in India at this point in our healthcare environment. While we have some fundamental things really working for us, if we are able to really put in place minimum standards that are enforced for any kind of player, old, new, doesn't matter, that will really ensure that everybody is not following only their own moral compass, but following a national compass, which is the only way we can together collaborate to represent a global face that is truly based on quality, truly based on access. Because if every Indian has access to healthcare, but every second Indian is getting a bad diagnosis, and therefore bad treatment, that doesn't help anybody. If we are able to make Indian healthcare the cheapest, lowest price point in the world, but it's not good treatment, it doesn't help anybody. And we cannot export this to other parts of the world or attract people to come to India unless we are able to really truly show that we are consistent in our approach of being able to cater to all Indians and globally. And I think that then links into our ESG thought process. Because at the end of the day, ESG is just a framework for doing the right thing. And not only doing the right thing for yourself, but doing the right thing for community. So unless we genuinely care for the patient charter, we genuinely care for their safety, we genuinely care for their privacy of their data, the quality of services that we offer them, unless we care for the environment and how we are dealing with waste and how we are dealing with pollution, and we are not truthful and honest about the way we govern ourselves. I mean, if that doesn't come from the purpose and the intent, it's very difficult, I think, to force fit it. I think from Metropolis point of view, we're a little bit lucky because I think we are, we definitely have the intent, we definitely have the resources, and we definitely have the framework in place to be able to carry out on our ESG journey. For us, I think being one of the largest diagnostic chains in the country and in Africa, we see very bottoms up and closely the challenges that consumers go through, our employees go through, and societies go through. And we have, while we have taken obviously and quantified on every one of the ESG parameters and taken sort of 5 key criteria that we want to achieve, I think for us it comes down really broadly to 2 things. The number one thing is about how we can impact local communities. Because our business and what we do is about people. It's about taking care and nurturing people and nurturing communities. So really bringing all of the great things we do, good or bad, in terms of under the ESG framework, but really boiling it down and say that, look, after we do all of this, does it really help the local community? Has been our lens through which we are deciding where we should focus and where we should not focus. And I think the second one is really about empowering and nurturing talent in the medical community. And I think this is another one which is very important because we can talk about India, heal in India, heal for India, all of the things. But the reality is all of this is going to work only if our medical talent is constantly learning, is constantly getting better, is constantly developing. They are motivated to do it. There are scholarships for young, poor kids who want to be doctors to be able to gain that knowledge. And Metropolis is trying our best to play a part. We started a program called MedEngage a few years ago, which is all about giving scholarships to young medical talent for them to be able to pursue their dreams and really become good doctors. And that could be in any aspect. It could be in R&D, it could be in clinical practice. And it's something which has been really joyous for us because we are able to reach out to 5,000 students every year, give scholarships to a few hundred. And we've really seen these students evolve in their journey. So to me, I think the ESG process is more about finding the intent and the purpose within ourselves. After that, being very clear and having clarity of thought of what we are trying to impact. None of us can impact everything. Picking 1 or 2 things that we can truly impact that will help our society and our communities. And really going after them, quantifying them, driving them like we drive our business through KPIs, making sure we have measurable ways of actually reaching outcomes, and not only looking at it as a best effort basis. And last, whatever we do, we need to really think about, I think, to ourselves, are we doing the right thing? And to me, if we ask that question, then honestly, all answers come forth. But I truly hope that, India, our diagnostics industry, continues to flourish, grow really well, and all of us in the industry across healthcare really adopt ESG as our anthem for the next 10 years. Thank you, everyone.
Thank you very much. You have made a very strong plea for minimal standards that are inviolate in order to ensure quality assured health services are delivered efficiently and ethically. We have also called for the critical capacity to be built so that whatever is planned is appropriately delivered. And you affirmed that ESG cannot be just a platitude, but has to be a conviction that has to be acted upon. Thank you. Mr. Vallabh Tiwari, Mr. Vaibhav Tiwari, I'm sorry, from Portia. Sir, you have been a pathbreaker in introducing and sustaining home health care with compassion. What are your suggestions to improve healthcare accessibility and affordability? And how do we fail-proof the public health ecosystems, especially in response to significant crisis, so that they do not crumble, but can stand firm and deliver?
Thank you, Professor Reddy. I think just give a quick 30 seconds about what we do. Portia is India's largest outside the hospital healthcare provider. And we have been working with patients across 40 cities across the country and providing them home care services in the comfort of their homes to basically heal them better and heal them faster. To look at your point of how healthcare become more affordable and accessible, I think there are 2-3 big changes which are happening. And as we are mentioning about crisis, I think the biggest crisis which all of us world over faced was COVID. And we saw that through basically 3 different waves of COVID, the multiple changes happened in the country. And I will probably take more from India as example and see how we can make healthcare more affordable and accessible. So one, of course, is that patient's view, the consumer's view, as well as the provider, that clinician's view on how to use technology changed 180 degrees. So before that, were we very open to using technology in healthcare? And of course, it was making small steps, baby steps, but COVID basically necessitated that healthcare consumers are willing to basically search for healthcare services online, to consume healthcare services online, and to be engaged for healthcare services online. I think that's something which is a massive change which happened over 3 different waves. And of course, some bit of that has got rolled back as after COVID wave 3, the whole fear has subsided. But it's still, I think, a big chunk of people looking at digital media or digital channels to basically to consume healthcare has increased significantly. So I would say, and similarly from doctor's perspective also, the clinicians' acceptance of using teleconsult or using other digital medium to basically reach out to patients and support them has changed significantly. So that is one big change which happened. Second, I think, which happened in COVID is that, especially during wave 1 and part of wave 2 also, as patients are unable to come out of their homes for lockdowns or lack of beds availability and things like that, the big change also happened that can the healthcare be provided at their doorstep? So home care, of course, became a lot more prominent in that sense. So, and third thing which happened is that for COVID, home isolation, government also approved insurance coverage for home isolation. So I would say these are 3 big changes which happened from a healthcare delivery perspective, which can, in effect, can make it very, very affordable and accessible. And fourth thing also, of course, the government has started investing significantly in healthcare. I think that's one big change which happened. It came on everybody's radar. So now, how do you make healthcare more accessible and affordable? And one, the most important thing, given our ratios of beds to per 1,000 patients, number of hospitals, number of clinicians, and we know those ratios don't hold very well compared to developed market standards. So how do you use technology very effectively, not only to do the diagnosis, not only to do the basically teleconsult and understanding patient condition, also in terms of how do you use technology in terms of collecting the patient data? How do you use basically that to use that data to create the patient history, to make sure that their treatment is probably happening in the best possible manner, taking all their ailments, taking all their chronic conditions and everything into account, right? So I would say that is something which is a big tenet for making sure that it becomes more affordable and accessible. And we are seeing things where government is working on it. There are a lot of private organizations working on it, taking healthcare to rural areas, to villages, to tier 3, tier 4 towns, and making sure that using technology, they have access to the best of the doctors available from the big cities. Hospitals themselves also are probably reaching out to all these remote locations, saying how they can support with best of their doctors. I would say that's the one thing which is a big change, which can make it very accessible. And of course, using technology makes it more affordable as well. Second thing is, of course, again, how do you make sure that patient data which you're collecting, and the whole National Digital Health Mission is a big step in that direction, right? So if we can get all the patient data together in one place, it basically takes away, it basically helps clinicians and service providers like ourselves to create the customized treatment plan for the patients, and of course, probably reduce the cost of healthcare and make it more effective for the patient. And there are multiple initiatives which are happening in that space. Things like community healthcare entrepreneurship, which is we are doing with a couple of partners. There are quite a few other organizations which are looking at that, saying can we in rural areas, tier 3, tier 4 towns, can we create community healthcare champions, and can they basically help people to manage their health better than what we have been doing? That's another thing which came out of COVID, that people who had chronic diseases were more prone to higher suffering in COVID, right? So people's awareness about their health also improved significantly, or has increased now. So other thing which you can do on top of that is that how do you focus more on primary care, preventive care, chronic disease management? So a burden on tertiary care comes down. The more we are taking care of our health, it also makes it more affordable in that sense, right? If you are taking care of our health. So our whole community healthcare entrepreneurship program also works in that direction, saying that if I have people who are helping the community to focus on their primary health and helping them to manage their the chronic disease better, that also helps that overall burden on the tertiary care side. So I would say having innovative solutions for the patients, for the larger community, using technology, using data more effectively, and of course looking at how we can support patients with their primary healthcare needs, with helping them to look at treating their chronic diseases and everything more effectively, more proactively, will probably make the whole healthcare system a lot more accessible and affordable. And there are multiple examples of that. I can give one example in which we collaborated with government. So when COVID wave 1 happened, especially during the lockdown period, and at that time, of course, now it looks like a long time back, but whole home isolation, given in wave 1, COVID was an unknown entity, right? So in wave 1, we worked with many state governments, 6 different state governments, and created this whole home isolation program, which was done totally using teleconsultation and follow up by healthcare workers for the patient to basically be in their homes and recover from COVID in their homes. And only if somebody had situation worsening, we coordinated with the government agencies on the ground and took them to the hospital for the treatment. Now in that, we supported over 4.5 lakh patients across different states, right? And that's something which is really a big example of how technology and the same healthcare system can support a lot more patients in a more affordable and more accessible manner, right? So big example which we executed ourselves along with the government. So I would summarize saying those are 3 big things to focus on. Focus on primary care, focus on preventive care, focus on chronic disease management, because awareness is much, much higher now. And if you focus on these 3, our load on tertiary care comes down. And of course, second thing is to use technology a lot more effectively. And the third one is the patient data, I think, which is a National Digital Health Mission is the biggest step in that area, is again something which will help us to reduce the burden on healthcare and make it more affordable and accessible.
Thank you very much, sir. The future of healthcare will substantially depend upon an efficient primary care system, which will deliver healthcare at home or close to home. But one of the important positive externalities, apart from providing greater access, more speed, and improving the quality of healthcare with the kind of services that you're providing, is also that it is going to be very friendly to the environment. People who don't have to travel long distances and frequently to hospitals, and if hospitals do not have to admit people for long admissions, the care is actually being provided mostly at home and mostly early to prevent serious complications, then we can save a lot of energy and resources. So even the E component of ESG is going to be very well supported by what you're doing. Thank you. In terms of the next speaker, who really requires no introduction because he is featured in the inaugural session, Mr. Mosur Sai-Sekar from Legato. Sir, your organization is in a unique space where you create healthcare products for the United States of America. And of course, now you're influencing the health scene in India as well, substantially. You leverage technology for speed, scale, and quality. How can you further leverage your model to bring about a large-scale digital transformation to strengthen delivery, accessibility, and availability of healthcare services, with a strong focus on the most needy and the poor who are generally deprived of good quality healthcare?
Thank you, Professor, for the question. I'm hoping I'm not on mute. No, I'm not. As a global capability center, as I explained earlier, we service Elevance Health for the primary part, right? Our solutions, our capabilities are focused on the US market. However, Elevance Health has several programs and solutions in taking healthcare services to the grassroots level, right? One is their vaccine program. 2 is their engagement with the communities. 3 is the Elevance Foundation itself. 4 is in terms of grants and so on that happens. In India, we focus on a couple of things. Okay? First focus is on community initiatives to support the health and well-being of the less privileged. This we have been doing, and as I articulated in my previous session, or the early part of the session, especially for women and children, we are focused on providing through our programs within the India community in all 3 centers. Okay, that's one which we are doing today. Now, I also indicated that we are collaborating with the new age startups to bridge the gaps in terms of accessibility and offer solutions to the community we support. We definitely see that as an opportunity for us to enhance really providing our digital transformation, our digital thoughts and assets in terms of providing that accessibility and availability of healthcare services, or through the new age startups provide that accessibility and affordability to the needy and the poor. That is how we can today really make a difference in the Indian marketplace, because we are wholly owned subsidiary of Elevance Health, and our solutions are primarily to provide solutions for Elevance, but we do contribute through our community programs as well as partnerships in India.
Thank you, sir. Thank you, Mr. Krishnamurthy, for that. Now, Mr. Sahil Dharia, we recognize that women's health has been a long neglected area, and that has tremendous implications for our own development. Women's hygiene and healthcare is closely connected to women's stakes in other sustainable development goals, like overall empowerment, their education, their participation in employment, their relief from poverty, and even participation in sports or cultural activities. So their all-round human development and economic contribution can be considerably hampered if we do not pay attention to some of their health issues. And one of the areas of neglect has been menstrual health and hygiene. How can addressing menstrual health and hygiene enable progress across various SDGs?
Thank you for that question, Dr. Srinath. To introduce ourselves, we're a company that manufactures, distributes, and markets personal hygiene products. We manufacture sanitary pads under the brand name Pari, baby diapers under the brand Super Cute, adult diapers, hair removal creams, and so on. We are heavily invested in women's health and hygiene businesses. We're a young company. I'm the founder CEO. I'm an ex-banker, I'm ex-UBS, ex-Reuters, worked on Wall Street, came back to India to make an impact in the Indian healthcare. I think we started the question of how do we do something that helps move the needle in healthcare. And typical banker style, top down, looked at what can move the needle, and we landed up at the humble sanitary napkin. It's a 3 rupee 50 paise product per piece. And here's what I found, and that's why I'm invested into this business. And since then, we have several institutional investors, public money invested in us, and so on. We saw, Dr. Srinath, I saw that 75,000 women die of cervical cancer every year in India. And an additional 150,000 are diagnosed with cervical cancer each year in India. This is Ministry of Health and Family Welfare data. Over and above that, 23% of girls drop out of school at puberty. This is UNICEF data. And you may also know that if the women workforce participation rate of women match those of men, our GDP would jump 26 percentage points. That's roughly $600 billion. And this is the cost. So a lot of people think of sanitary napkins as fluff or feminist stuff. There's actually real mortality, real health burden, real productivity and economic burden of not including women in the workforce when thinking about women's health and women's health care and hygiene. These are the numbers, right? So for us, as we came into this business, we said, wow, this product that's a $3.5 product really moves the needle with women's education, women's health, women's productivity, like name it, mortality, everything. And it just made a lot of sense to be invested in this product. By the way, did you know that only 25% women in India use sanitary pads? 75% women in India still use unhygienic forms of menstrual protection and management. And so there were overwhelming reasons why we wanted to be invested in this business, and these are those. So for us to be in this business is about obviously creating stakeholder value. We are founded with a vision to improve the life of the community we live in. So there's obviously value to be created. Secondly, I'm an ex-banker, so we think of, while EBITDA may not be a sexy word over here, sustainability goes hand in hand with EBITDA. We are here to create value and create sustainable value. But finally, we have a very strong sense of purpose attached to us. These are the numbers that we spoke about that affect our business. So we are guided by the fact that at Soothe, at Pari, we say, if you are investing in a young woman, when you give a girl a sanitary pad, she goes to school. If she goes to school, she gets a job. If she gets a job, her family of 4 is better off. So investing in a young woman is the highest ROI in society. And that's what keeps us going. That purpose, the high social impact we create is what keeps us going. And it is with this in mind that we actually invested in a meaningful capacity. We currently have installed capacity to make 1 billion, that's 1 billion sanitary pads and diapers per year. We have a nationwide distribution channel. So as opposed to if one falls sick, you go to a doctor, our approach to solving the problem is, can we take simple, affordable, scalable consumer healthcare products, distribute to the masses, prevent disease rather than trying to treat it? That's our thesis. So with that in mind, we built a large distribution network. I'm available in 275,000 stores across India. Of course, we're available online. We're available in the leading Walmarts and the supermarket chains in India. But we have to be where our customer is, and accessibility is one of the key barriers to entry for our business. So we make distribution an important barometer to measure impact. So we are present in a meaningful amount of stores all across India. And that is how we solve this problem, by making sure the product is accessible. Just to give you an example of a few of our campaigns, during COVID, we've seen a lot of time, Dr. Srinath, we often in healthcare, we have seen instances where the male is prioritized over the female for reasons which are unique to the Indian subcontinent. We saw that even in COVID, where there was disruptions in supply chain, there were disruptions, and so every sort of aid was sought from folks, but nobody asked us for sanitary pads, and we had to go and convince people, well, what are you going to do without this? That included us actually reaching out to the PMO to say, well, you shut down everything, but even if you tell people to sit at home, how do you function without a means of hygienic and a dignifiable way of menstrual hygiene management? You need to allow us to remain open. And sure enough, they agreed. The next day, we were given an order to start operating and provide this essential product to India and ensure that it remains on shelves. So this is the work, and this is the so we've done some meaningful campaigns with like-minded people, including Dr. Bedi, Kiran Bedi, in working with the police women to ensure they get access to this product and they understand the importance of. So the focus of our campaigns is why to use a sanitary pad, how to use a sanitary pad, and how to dispose of a sanitary pad. And it is this. With this, we measure impact and how do we move the needle on SDGs. Finally, just to walk the talk, Dr. Srinath, we're a company that manufactures sanitary pads, baby diapers, and adult diapers. Bulk of this is used by women, right? Products. We're a company where 80% of our staff are women. Corporate, the building in which I sit in, 80% of our staff are women. 75% of my founders, CEOs, management team is women. So we actually the joke here is we also hire men. So we have a reverse diversity target that I get anonymous chits in my office saying, please hire some men. So, and why not? I mean, we have a product that is, how much does a guy know about sanitary pads, right? So this is us. And hopefully we are moving the needle with our distribution, with our massive manufacturing footprint, and providing affordable and value creating products for India. Thank you.
Thank you very much for reminding all of us that removing barriers for women's health and well-being is both an ethical obligation and an economic imperative. So we must ensure together as a society that we bring women's health issues out of the penumbra of public policy and public health action.
Yes.
We now have a final participant in this panel discussion, Mr. Ashish Agarwal from Nagaro. Mr. Agarwal, we have heard a lot about the role of technology. We have heard about the transformation that can be brought about in health systems with digital health or other technologies, point of care, diagnostics, home care. But going beyond these technology-driven innovations and services, which are essential, of course, what are the other offerings that you feel must be used for total employee health, particularly in business organizations? How do we foster and protect health and well-being of employees? What kind of interventions are needed? You're muted, I think, sir. We can't hear you. At least I can't hear you.
Hi, can you hear me now?
Now very well,
Yes.
thank you.
Can you hear me? Okay, great.
Yes, we can.
Okay,
Yes, we can. As
for having me.
Mr. Obama said, yes.
Yeah, Sahil, it was great to hear what you have done, by the way. Congratulations. It was amazing. And thank you, Mr. Krishnamurthy, for sharing what you did. I think COVID did change a lot for the industry, for the country, for the world. And let me actually take it from there. And women empowerment that Sahil talked about. What actually happened in COVID was people were working from home. A lot of companies had to shut down their physical office operations, and many people were there at home. And what changed during that time, what many of us do not realize is that women, for example, came into the workforce in a very big way, because people who were caregivers to elderly, to children, now had the flexibility to be able to manage work as well as be able to manage home in a flexible way while they are at home. So basically, what essentially changed was there was a sense of control that now went back to people during the COVID times. And what the industry is now sort of trying to change is go back to its old ways of working. And that's something that I would like to push back on and say that we need to continue with a certain way, the shift that has happened. Like, for example, when the industry moved from having horses to having cars, or from having letters to email, it was a forward shift. And then the industry continued to move forward from there and make changes to adopt to what has been brought forth. Similarly, I think what needs to be understood is that if we can empower people and if we can continue to trust people, you can get great results. At the end of the day, we hire adults in the industry. And it's important that we understand that a human being is much more than just the physical and mental well-being. It is also the overall well-being of the person, which requires financial well-being, career well-being, community well-being, and all of those elements, which are actually very well articulated in Maslow's hierarchy of needs. We need to feel secure, we need to belong, we need to feel recognized. And technology has a major role to play in that. because how technology can really help is bring, for example, all the data that's there in the organization to the human being, rather than a person having to go and find all of that information, and bring career options, career choices to the person, bring health and well-being choices to the person. And the other very important thing is that we also need to understand that as humans, we don't necessarily always make the right choice for ourselves. We all know that physical activity is good. We all need to be healthy. We need to be, eating the right food, but we don't always follow that. We forget that. So the industry needs to make sure that it is only guiding people. It is giving the right information at the right time so that people make the right choices for themselves. They are empowered to make the right choices for themselves. But then instead of managing people, instead of controlling people, really empower people and let them move forward from there. So that's something that I would strongly recommend for the industry.
Thank you very much for aiming to provide a very supportive work environment, which looks holistically at what the needs of the people are. And in a digitally hyper-connected but emotionally disconnected world, this kind of an initiative is much needed indeed. We do have a little time, so may I just request brief comments from each of the panelists on how they feel, not only within their own immediate industry environment, but across the supply chain of distributors, vendors, and the customers, as well as perhaps even the shareholders who sometimes influence policy. How can they disseminate the ESG philosophy and ensure that that is adopted by everybody as a norm? Ms. Shah, would you like to take the lead?
Thank you, Professor Reddy. Look, I think it's going to be all about the people in the relationship with whichever stakeholder there is, whether it's a vendor, a customer, an employee. And if we do it with purpose, what are the points at which it can be enforced? So for example, if investors are doing it with corporates, can corporates do it with their vendors? Can there be extra points given to vendors who are following ESG? Can they be given preference? I know I used to be on the board of a advisory board of a very large financial services and insurance company based out of Paris. And at one point, they just decided and they just made a decision, and they said they used to own, many companies, including health insurance. And they also had a coal company. And they decided in 2008, as they started the ESG agenda, in 2015, we kept asking them and said, look, you can't say you're ESG compliant and then still run certain businesses, which may not be necessarily suitable for the environment. And they finally sold all those businesses. They just exited them. The same way they invest something like $600 billion globally. And they just made a rule and said, look, we're not going to invest in companies that are not ESG compliant. So I think some of it is just making a call and taking a stand. And if your business is valuable, your employment is valuable, then people will adhere to it. And I think it comes back to the conviction and doing it with. But I do believe that it is the right, privilege, and responsibility of each one of us as leaders in the industry to spread the word and to really take those stands, to make it possible for potentially smaller players who may not feel that there's anything in it for them. But there is no choice, and therefore it will have to be done till the time there is merit seen in what it is for them. So I think, often people may not like it when we say carrot and stick. But I think often in life, we do have to use both methodologies to drive certain agendas. And all change in life, all transformation in life in the world has actually happened when we use a combination of the two in different ways. And stick doesn't really mean stick, but it just means a little bit of push, a little bit of pressure, a little bit of a little bit of encouragement. And I think we can get there.
Indeed, policy is like a frozen carrot. It's both a carrot and a stick. So you ought to be able to use it well. Okay. Mr. Tiwari, please.
See, from our perspective, I think the social part of ESG is quite prevalent, both from Portia's perspective. I mean, we have what we call general duty assistant or nursing attendant. That's a fairly large population whom we hire from tier 3 towns, from rural areas through NSDC partners, and more than 60% of those are women, I think, and of course they come from economically weaker sections. So in that sense, that's a big impact which we have been able to make from a social impact perspective. We have trained almost maybe 15,000 plus GDAs so far, who have basically come to us in different cities in last 8 to 9 years and have got an employment, got training and got employment, right? And around 60% of those have been women. And the impact which they create is much larger, not only in their own work and self-esteem and things like that, and also impact back home which they make. And partners whom we work with, as part of this, we also work with a lot of NSDC partners, different government agencies. There again, the focus on making social impact is very high. And I think that's something which home care especially has been able to create significantly. And we see that particular part only growing as more and more people are becoming aware of saying that, okay, this is a great career option which they can provide, and us also reaching out to much larger number of locations. And this industry overall getting more recognition as a viable option to take healthcare to the patient's home. I think the social impact of what we are doing and what our partners are doing is only going to multifold as we go along.
Thank you very much, Mr. Krishnamurthy, sir.
Hi. Yes, see, first of all, ESG should not be optional. It should be mandated either by the government or by the board. But not always it needs to be mandated by either of them. It could be something that each of the organizations can take responsibility and pursue ESG efforts. From a Legato perspective, we are focused on ESG in all the efforts that we do, whether it's transportation that we provide for our associates. We use a large number of electric fleet, and we plan to do that, and we plan to continue to do that. All our buildings are LEED certified. Okay, we are in some buildings which are platinum certified, some buildings which are. We reuse material, right? Everything from utensils in the cafeterias to so on and so forth. We don't use paper. We are reusable materials is what we use. We have a large recycling program for everything that we use, e-waste and so on and so forth. So we are very conscious about leveraging ESG and implementing ESG in everything that we do. And whether it is even the VRV solutions that we have put in place within the offices and the air quality purifiers and so on and so forth, we are very conscious that we are focused on the environment across the board. So it's a responsibility that we have taken. There is no regulation around it. Nobody has mandated us, but it is just a self-governance that we have done in the organization.
Thank you very much. It's very gratifying to know that ESG in policy and practice is the double helix of your organization's DNA. Mr. Dharia, please.
Yeah, I would actually like to echo what Amira said earlier, that ESG begins with, unfortunately, it begins with what's in it for me with a lot of people. And I think we are at that inflection point in the world, or even in India, where ESG is not a nice to have, it is a must have. Whether you think about it from the perspective of what we're leaving for our kids, or the community we live in, or the disparity between the haves and the haves not, whichever way you want to look at it, I think if you want to scale, and if you want to be able to solve the problem of 1.4 billion people in India, and you want your business or whatever it is that you're doing to have scale, you need to be able to think of environment, social, and governance. You cannot scale if you don't have a ethical governance structure and an ethical team and so on. And you're sustainable socially and as well as environmentally, you're giving back. I think that inflection point has reached where this is required. I don't think it's a nice to have anymore. And I don't think that we don't live in a world where brownie points need to be given for this. It's a must have. And the faster adoption of this will happen if promoters and CEOs, etc., we are educated and literally open our eyes and telling you why it is you must do this. You will not be able to scale without it. I think that should be the carrot to do it.
Thank you. Mr. Agrawal, now it's your turn to score the winning runs.
No, I think everyone is a winner here because all the points are very valid and I agree with them. I think Sahil is getting closer to the answer in my mind as well, where it's about the individual at the end of the day. Like we cannot be thinking about ESG and leaving our air conditioners on. We cannot be talking about ESG and leaving the lights on or not caring about how we are, ordering things from online e-commerce platforms, which come with all the boxes, which come with all the plastics. And, with every individual looking at their own behaviors and looking at the impact that they are creating and educating themselves, ourselves, that what are we doing today that is creating a negative carbon impact. If we have our air conditioners on for all nights and we do not have a nice home insulation in place, then it's going to become a problem. But still going out and saying, hey, we are going to do ESG and we are going to reduce metrics or improve vendors, that's not really honest, right? You have to be honest to yourself. And when you're honest to yourself, you will automatically do the right thing for the ecosystem, and you will ask for those things, or you will educate others in the right behaviors as well. So to me, it's fundamentally about starting with yourself rather than focusing on what the larger ecosystem can do.
Thank you. So you have emphasized that every single action matters, and we must actually consciously or subconsciously act accordingly. Indeed, as Ms. Shah said initially, it has to be the moral compass of every industry, but it also has to become the GPS for guiding every single action and movement forward. Thank you very much to all of you for being inspirational role models, but also ensuring that you will be disseminating this message so that it diffuses across your entire ecosystem to create a multiplier effect. Thank you.
Thank you very much.
Thank you so much, Professor Reddy, and all the panelists for highlighting solutions on how businesses can be a force for good. With dedicated investments, innovations, and robust regulations, make resilient healthcare systems to mitigate the need of the present and the future healthcare concerns. Thank you so much, everybody, for joining us and sharing your most valuable insights with us today. Now we move on to our next panel discussion of the day, session 2, interconnectedness of health and climate change, increasing business focus on people, planet, and profit for SDG 3. The moderator for this session is Ms. Vandana Saxena Poria, OBE, Chief Alarmist at the Human Alarm Company. The distinguished speakers for the session are Dr. Durga Prakash, Staff VP Technology, Legato Health Technologies, Dr. Nora, Program Director, Women Lift Health, Dr. Nimish Shah, MD, IAPMO, Ms. Samira Lakhani, Project Controller, Commercial and Industrial Energy Deployment and Products, Tesla. Thank you so much, all of you, for joining us today. Now I hand over the floor to our moderator, Ms. Poria. Over to you.
Thank you so much, Shreya and Asimji. You can hear me okay?
Yes, absolutely.
Greetings from Sydney, Australia, where it's a little bit later than where you are. So we're talking about something that is so crucial today. And, again, I can really commend the United Nations Global Compact India for taking on this great initiative to have people speaking about something that potentially impacts all of us. And now is the time to be in action. Almost 90% of the global population could be at risk from malaria, from dengue, from cholera by the year 2078. That's 8.4 billion people. Climate change is boosting reproduction in mosquitoes. We're already seeing the devastation caused by floods and heat waves, air pollution. We're seeing, for example, with heat waves, the increase of skin cancer, of heat stress, etc., etc. And it's pretty non-stop. So what can we do to actually change things? What are companies doing at the moment to actually change things? And what will we need to take on in order to create a better world for all of us? Well, we have a fantastic set of panelists who are going to be speaking. I am going to go straight into questions. I'm not doing introductions of the panel because I think you've got all their details anyway. So I'm going to go straight into talking to Dr. Durga Prakash. Dr. Durga, thank you for being here today.
Thank you, Ms. Poria. And first of all, let me express my sincere thanks to UNGCNI and the Elite panel. And it's an amazing discussion. I really heard all the keynote speakers gave an excellent speech in the past. Basically, I'm part of the Sai's and Legato's leadership team. We work on the digital transformation and building the platforms which interact and solve the health problems for 1/3 of American population as we speak. And we are all like the young techies who built with innovation and technology to change the world with better access to health and providing platforms and solve the problems of a different scale and impact by sitting in India as a global delivery center or a global capability center.
It's fantastic. And the work that you're doing with data analytics to try and mitigate some of these problems is fantastic too. So the question that I have for you is, how can we leverage innovation and technology to address the healthcare needs induced by climate change? Things like health issues related to severe air pollution, lack of safe drinking water, sanitation facilities, etc., especially thinking about the most vulnerable populations.
Great question, Vandana. I think if you can actually just step back and look at the whole interconnection between the health and the climate change, right? So the bottom line is we all want a healthy planet, which can also be sustainable. And this discussion came at so timely that we are seeing an excess rain in Bangalore. And if you can see the other side of the world, California is really going through a big wave of heat, right? And we never heard 112-degree Fahrenheit in California. And look at the dichotomy, right? Heavy rains and heat waves. And I was actually working with my team, and one of the best teams that we have here at Legato. They really did research, and they're trying to help me with excellent data points. Approximately about 5 million people die because of this abnormal heat and the cold temperatures, the floods as we speak. And extreme heat conditions, what you see here, can exhaust people, worsen health conditions. And as a health company, what we do is we really understand the link between environmental health and the whole health of the human beings on the ground. That's what our major purpose, right? We address the health of a humanity, right? But there are some interesting dichotomies I really want to talk, because we are really talking about the vulnerable population, right? So look at technology can actually equalizes the impact of a climate change in a scenario like a very widening economic inequalities that we have today, right? And this climate change is a very interesting dichotomy between the rich and the poor, right? If you see, the report says the vulnerable people are basically the low-income group, economically deprived, the old people who have the pre-existing health conditions. They are the one who will be first impacted. But on the other side, if you see, the Bloomberg report says the top 1% of the wealthy people have the highest propensity to contribute to the combined carbon emissions. Thanks to their lavish trips to space, the exorbitant hatches, and the great private and the business jets, right? But it is also important, the actions of the rich is what is causing the vulnerable populations first impacted on the the climate change actions, right? So, and the other side of it is the top rich people are the fastest adopters of the technology as well. That means if they adopt the technology, they're actually helping the vulnerable people. That is how the innovation and technology can help. Imagine a Fortune companies reduce their travel, start using the digital technologies to do their meetings and important decisions over the channels of digital, right? And this is exactly what the technology can equalize the impacts of climate change between the vulnerable and the rich population, right? And if I can really give some examples, we as a company, we have built a signature platform known as Sydney Health. It's a 2-year-old or a 3-year-old platform where 12.8 million Americans are today using that platform to do day-to-day health services with large providers in the United States, right? And it's completely a paperless, right from getting a quote of your insurance premium to paying back your claim, right? So everything is happening on a digital platforms where we are working towards reducing the collective footprint because we are minimizing the trips, travel, and a lot of calls, etc., to the businesses, right? So that is the transformation, how we are bringing innovation and the technology to reduce the collective carbon footprint on one side. On the other side, if you look at it from our own internal perspective as a company, we are working with young startups, right? I can name one. There's a company known as Nirmaya.ai. We are working with them to proactively screen the cancer in our women employee population, right? And there is a higher risk of cancer where there's people who are exposed to the nitrogen oxide and nitrogen dioxide, which is part of our common, pollution that you see in our traffics, right? And this is a company which brings the latest and greatest of AI, a simple thermal-based scanning system which can tell us whether there is a problem or there is no problem, right? And there is an innovation startup, small company which is helping towards really screening the people, and the total cost of the screening is less than $100. And it's an Indian innovation. It's approved by an FDA, right? And today we are trying to understand the power of technology, use it in our own business so that we can take it to the deprived and vulnerable population down the line through our own CSR groups. Similarly, we are working with another startup known as Maitri Tech, which actually produces the clean drinking water from atmosphere. Without any plumbing, there is no degree of contamination because of the pipes, etc. and all. So, I mean, the long story short, enabling technology and transformation is something that can really help not just only the deprived people, but although the rich class and the established MNCs, what we see here, right? And if I can really summarize the theme of the climate change, health problem, technology equalizers, and building the new innovation, I think if I can clearly say the artificial intelligence and ML is what we use as an innovation in our own organization. And we have built some signature platforms for the caregivers, like the nurses and the clinical care managers. By looking at the data and the digital platforms that we have, we are doing the proactive interventions to our own people, right? And really helping them how they can proactively take the health and the medications much before they really go into the severe stages of the disease. And finally, I really want to tell one of the nice platform that we are building now known as Health OS. Across the United States, both payers, physicians, and providers can come and work on this digital platform where there is a propensity of collective carbon footprint reduction to almost 50% of what they see today because of the complexity of the demographics that we have in the United States, right? So again, if I can quickly talk about the real technology that is helping, I can give another example. There is a Swiss company known as IQ Air, and this has built a strong digital platform which is really tracking the real-time air quality in 5,000 cities. And with one fingertip, you know where is the contamination, where is the problematic air that you have, and they're planning to launch it in every mobile phone. So, I mean, the real aspect here is the digital data and AI as a technology backbone can help us to increase our ability to respond to the climate change, whether it is deprived or the rich class. And again, I just want to quickly summarize with a quote what I have learned from Emerson. The first wealth is always a health, and health is the foundation to build a great life, great community, and of course, the bigger profitable businesses or economies, right? That's what we at Legato work towards, health of a humanity. Over to you, Vandana.
Great, great. Thank you so much. That's really, really helpful. So we know that at the end of the day, what we're seeing every day is this a huge amount. You talked about California and Bangalore, and I remember I was in London a couple of weeks ago, and London had a red alert for the heat, and Pune had a red alert for the floods. So it's the same thing, you know, it's happening all over the world. And unfortunately, it is the most vulnerable who are going to suffer from this. So it's lovely. I mean, it was interesting to hear you say it's really the top 1% that are causing the problems. And it's that top 1% that can also potentially help us equalize and use technology to actually stop those problems from occurring. And it sounds very much like Legato, as with others, is really focused on real-time, preventable and proactive services using AI and ML. So thank you for telling us about the fantastic things that you're doing. And it's also really great to hear that you're working with startups, because not all the best ideas are going to come from the biggest organizations. They're also going to come from the smaller ones. So it's great to know that they're getting the share of voice supported by an organization such as yours. So thank you so much for that, Dr. Durga. So I know we have Dr. Nora Akongo Obudo. I hope I got that right. The Program Director of Women Lift Health. Hi, lovely to have you with us. And thank you for all the amazing work that you do. Now, we've just talked about the fact that vulnerable people are the ones who are most at risk from climate change. And we have to accept that women are actually the most vulnerable when it comes to sort of the impacts on their health of climate change. Many of them, we know, are walking long distances to get water. There's a lack of sanitation facilities, not just in the villages, but in the schools. There's a lack of knowledge. There's challenges with clean cooking gas, etc. What we saw during COVID was that women were disproportionately more vulnerable than the men were. And dare I say that 90% of the problems are being caused by men and the large industries. Anyway, I'm perhaps not allowed to say that, but it's the truth and we should acknowledge it. So I'd like to know from your side, how can businesses focus on increasing access to healthcare for women and empowering them in this process? What difference is that going to make?
Great. Thank you. I think those are really, really good questions. And I am also very grateful to you and GCI for this opportunity to speak. I am speaking from Nairobi, Kenya, and so also looking at, the Africa perspective, being that we have, low income countries here as well as low middle income countries. And so maybe there are a few things that we also borrow from India as well. So I do work with Women Lift Health, and as the name is, women do lift health. We believe that where women lead, good health outcomes will follow as well. So our focus really is on women in health. We have noticed that even the studies and research has shown that even as much as women make 70% of the workforce, only 20% are making it to senior leadership and 5% are making it at the CEO level. But why is this important? Often we have looked at women as end users. And even when we look at a gendered approach, we're always counting how many women access the service, how many women were given this product. But we want to move from the point of counting women to counting on women, because women do need to be on the table to make these decisions. They come in with lived experiences. that can feed to every product that is being developed, can feed into every policy that is being developed as pertains health. So that is really just a brief on Women Lift Health. We are a global organization. We are based in India. We have a South Asia team. We have the East Africa team, and we also have the North America team, and also expanding globally because of the need of women's leadership and the need for women to be on the table where decisions are being made as pertains health. But of course, the questions would always come: why are we focusing on women? What are their vulnerabilities, really? And it's something I always face, that where men not being considered, men are being left behind. But of course, it's due to the different vulnerabilities they face, and now even more when we look at climate change. And we see that climate change impacts men and women differently, and this is due to the differences in their traditional roles, whether they're the ones providing food or tilling the land. That comes to play. The societal expectations: your place is in the kitchen, or your place is in the farm, or in more maybe advanced societies, they'll be taking up roles as well equally, and also in livelihoods. But we know at the same time that women make the majority of the 1.4 billion poor in the world. They have lower incomes, they have less access to credit and decision-making authority, and they have limited control over resources as well. This increases their vulnerability to many climate impacts. So you have mentioned they have to walk long distances. What does that present to women? There are safety issues there. There are violence issues there for women. They can be raped. There are all those issues that come in. When it comes to access to sanitation and facilities, then we come to the area where they're exposed to diseases, injury as well, to name but a few. There are a lot of outcomes that surround climate change issues. But then we come to the question that you're looking at: how can businesses then focus on increasing access to healthcare for women and then empowering them in the process at the same time? And access is a very big word. Access has a lot of things that come around it. Access is about health service in itself being available, and the service itself being comprehensive and tailored for the needs of women, and comprehensive enough and of good quality. That is an access issue as well. Another access issue is payment. How will you receive healthcare if you can't pay for it? The other thing is about decision-making. The women they have to make decisions, but how are they able to make decisions at the household level, at the community level? And there comes the power plays that normally exist. And then the other access issue, of course, is distance. How do I get to this facility, or how does this service get to me in the household? And I think we've talked about technologies that also make it an equalizer. In the opening statements, we talked about telehealth, telemedicine, creating that, reducing that distance and also reducing a cost. But of course, it is still something that's not spread out. And those are things that are surrounding access. So for businesses to support these women to access care, there's a whole lot that needs to be done, because we must acknowledge that in the delivery of healthcare, and even as we look at universal health coverage, that is a big agenda for Africa, and is also supported by health system strengthening. The governments cannot do it alone. The governments need a lot of support. Over and above the donor support, we believe in the private and public partnerships, and that's where businesses can come in. How can we support the governments to deliver these services and to achieve the universal health coverage as we're looking at it? I would also like to mention that even as we look at universal health coverage, it still looks at the woman as the end user in this case. So because we're trying to provide a service to them. But we also have businesses that can look at how they engage the women, even within their organizations in itself, and how they engage the communities that they're established at. So what am I driving at here? Looking at how business can integrate women empowerment in their farms, so to speak. So we're looking at having responsible employment practices, ensuring that we have gender diversity in the organizations. And this is what we're looking at in terms of DEI, where we're looking at diversity, equity, inclusivity. And in some areas, as we're talking about climate change, of course, there's the gender justice aspect to things. So we need to create employment practices that are helpful and supportive of identification of women as employees and retaining them as well in the workplace. We need to look at equal pay for work. That has something that has existed for long. And I have seen some studies that also came from India, where a lot of the health workforce, and even in Africa, women are not being paid at the same level as their male counterparts. And some of them are actually working for free. If you look at community health workers, a majority are women, but they should be paid because that will be part of the process of empowering the woman, because when she has purchasing power, she can make decisions. She is the consumer of health, and therefore she can access this health. And please note what we had just talked about, the factors that surround access to health: decision-making, ability to pay. So businesses as well can look at having healthy workplaces for the women, which is free of harassment and discrimination. And I want to call to this because as we conducted the discovery analysis as Women Lift Health, we tried to identify why are women not rising in their careers in health? Why are they not getting into these policy decision levels? Why are they remaining stuck at services delivery, yet they come in with lived experience and can only augment and improve the quality of decision-making in these spaces? One of the things they identified was sexual harassment and discrimination in the workplace. And this is something that we must address to ensure that women have an equal opportunity on these tables. As well, we need to look at opportunities for women to be able to advance. And these are things that businesses can look inwards and even in the communities that they are supporting. In addition, we need to look at businesses also need to look at products and services that will address women's unique needs. I really appreciated one of the panel speakers in the first session, looking at the women's unique needs in terms of the sanitary hygiene and knowledge. These are the things that we need to look at. We need to look at even the equipment that women use. Most of the time in the health space, all the gloves, all the equipment we've used have generally been masculine designed. And I used to face that problem as well in the theaters, where I'm looking for a glove and naturally our hands will be much smaller. And you have to put on doubles just so that they fit in. But how can we ensure that businesses are designing for women's unique needs, producing products that will enhance women's delivery and participation in healthcare? I think the other aspect, of course, is CSRs that come along that businesses can have to ensure that we are focusing on women and increasing the access. And this can be even in terms of supporting, as we talked about sanitary pads, we've talked about even supporting women in education, because women are still vulnerable at that point. If we do not educate, they do not get into the labor market, they do not get jobs. They do not have money in their pockets. They cannot make decisions. They cannot access healthcare. So I think for me, this is what I'm looking at in terms of what business can really do. We need to integrate a gender lens in our practices, identify and retain women at work, give them equal pay, adopt CSR in our works, and make the working environment friendly for women so that women can participate at those decision-making tables, and then we can add value to the decisions that are being made around health. And women can really speak to the access issues that they themselves are facing, as opposed to men majority at the tables. So let's involve women at the decision level as we move forward to increase access to health. And that is what I will put forward on this discussion. Thank you.
Thank you so much, Dr. Nora. So some really interesting statistics, some that we know about, but just worth reinforcing again. 70% of the workforce is not women, but we're getting women in at the lower levels, but only 20% into senior leadership, only 5% are making it to board level. And I loved what you said about what Women Lift does, which is instead of counting women, counting on women. But we can't count on women if the services that we're providing are geared towards men and men's needs rather than women's needs. The government can't do it alone, so business has to play a really important part. We need to engage women, we need to integrate them, we need to have responsible employment practices, we need to educate women, and businesses can play a role in this. They can start putting in quotas. They are putting in quotas, but they can actively do this. We need to find ways to ensure that women have equal pay, a healthy workplace. I think, Dr. Nora, what you said about sexual harassment in the workplace, if women don't feel safe, they would rather stay at home, and that's going to keep people, that's going to keep women away. So by putting that gender lens on, we would, you know, businesses can really make a difference. And really, like you said, government can't do it by themselves. They do need business to play their part in it. So thank you very much for adding to the discussion there. I know we also have Dr. Nimish with us, lots of doctors with us here, giving us really great advice here. Dr. Nimish Shah from IAPMO. Hello.
Hi.
Hi, good to see you. And thank you for being here. Now, I want to talk to you. It's an issue that came up with Dr. Nora as well, and it came up in the earlier discussions of the keynotes as well. Sanitation for all. Sanitation for all is extremely important, but what do you think is going to be the game changer business model to provide sustainable sanitation solutions to the last mile?
Sure. Thank you, Vandana, and you're bringing wonderful energy to this panel discussion. So thanks for that as well. And I would like to also thank Asim for inviting me on this UNGCNI panel and on getting all of us together on this really, really crucial issue of SDG 3. And as we began, Mr. Ratnesh talked about the interdependencies of SDG 3 on health and well-being with various other sustainable development goals. And here we are essentially focusing through your question on SDG 6, which is clean water and sanitation, and how we enable through the right kind of business model or other approaches to the most vulnerable population. So if I just take a moment to humbly submit that I come from a organization that is this thing about water sanitation and hygiene being a global issue got to be recognized somewhere around the turn of the century with the Millennium Development Goals, and it got re-emphasized very well as Sustainable Development Goal number 6 in 2015 with the SDGs. But I would like to humbly submit that I happen to represent an organization that is almost for over 100 years talked and has been committed as International Association of Plumbing and Mechanical Officials to the cause of water and sanitation. And that legacy really is allowing me to give a few, based on our experience, our insights, some forward-looking thoughts on how we can really make a progress on SDG 6 and women's health or vulnerable populations' health while achieving progress on SDG 6. And I think, COVID provided a very, very unique opportunity to bring about a kind of a hockey stick sort of an exponential change in business models to make clean, safe, hygienic water sanitation solutions to everybody, including the vulnerable populations. And let me start with a few examples I have seen in the recent past. So urban India is about 300 to 400 million people, of which about 100 to 150 million are women, and most of these aspire to go out and work. And one big barrier, regardless of whether this woman is earning thousands of dollars or earning paltry sums, both are equally vulnerable as far as accessing public sanitation is concerned, sanitation out of home. And what is happening is that we are seeing very unique models, entrepreneurs, pioneers in the water sanitation hygiene space who are providing digital-led solutions which are accessible on a pay-as-you-go system or a model, and also enabling discovery of clean and hygienic loos. Yeah. So now a woman in Mumbai, within 2 kilometers of the city, has an access to an app which tells her that, you know, this particular toilet, it might be sitting in a restaurant, it might be in a mall, is available for you to pay as a to use as a part, as you being a member of this app, for example. And then there is a whole ecosystem of health and hygiene goods and services, some of them specially targeted to women, that is available across that. So I think digital has made it very, very possible. The other thing the digital technologies is playing a role is in sensors to really help keep sanitation facilities clean as they should be, because lack of clean sanitation facilities for women is such a huge barrier that it impacts health, because they hold up, and that leads to bladder and kidney issues. So now it is possible to sense the odor in toilets and you know, trigger through the app to clean the toilet when the odor is high, rather than clean it at specific times during the day. So then it gets dirty when there is high traffic, but the high traffic leads to odors. So you can see propositions that are coming up through digital technologies that are helping you know, this cause. I also feel there is you know, awakening amongst the corporates, and I have seen that even in the smallest of the companies, the toilets for the employees, especially women, are becoming better, more equipped, including facilities for disposal of sanitary pads, or for that matter, vending of sanitary pads. And that is going up. And I must tell you this, that if it was not for COVID, this progress would have happened rather slowly. And I'm really pleased to see that things are happening in that sector. What we are doing to really help this evolve, because we have 3 pillars. One being developing codes and standards, second being testing services and knowledge services, and third being, you know, training and education. I must tell you, training and education and upskilling, we have done something very unique in the industry. We have a water purifier technicians program, for example. And earlier this year, with one of the leading digital platform of services, we certified India's first woman water purifier technician, by the way. So think about it, you know, there is somebody at home wants to get their water purifier service, but they would wait until you know, it is a weekend when all the men at home are there, so that a male technician come and services. But here we are empowering women to go any day of the week and service it. And we are also doing similar things in the area of plumbing and many other trades. So I think we are hugely committed to playing a role to enable water, sanitation, and hygiene access to vulnerable populations, especially women. And I'm pleased to see that on this platform, we have thought leaders coming together, looking in one direction, helping solve SDG 3 issues, but also really having a strong focus on the most vulnerable population of the society. So great to be here, and thank you so much.
Thank you so much, Dr. Nimish Shah. You know, really what we're talking about is the game changer is digital, and the game changer is training and education. Those two together, hand in hand, are what's really causing the difference or creating the difference. It was really interesting to hear about the app and the fact that that app is operational, and it means that women know where they can go. It's not as easy as it is. I promise I'm not really having a go at men, but I'm just saying for thousands and thousands of years, we have to accept that 80% of history has been written and created literally by men and for men. 80% of science, technology, religion has all been written by men, pretty much for men. And it's really great to see organizations like your own IAPMO actually doing things that are putting women at the forefront because of the vulnerabilities. The sensor technology that you talked about is fantastic. That really is a game changer. So if we can sense that the odors are bad, then we know we need the cleaning to happen, etc., etc. And the fact that you're doing these jobs or you're doing these certifications, so we have women who can come in and do plumbing or water purifying, absolutely fantastic. And that again is going in hand with what everyone's been talking about, which is enabling the vulnerable population to have and empowering them to have a livelihood, which will also make a huge difference. So Dr. Nimesh Shah, thank you so much for that. Now we have Miss Samira Lakhani, who is from Tesla. It's fabulous to have you. I think the whole world is looking at Tesla and just amazed. And I love the fact that you manage projects which are really about sustaining and generating efficiency when it comes to energy. So that's fabulous. So I want to ask you, Samira, how can businesses catalyze the transition to renewable and clean energy sources, but keeping in mind the adverse effects of severe air pollution due to, the challenges we have with emissions from things like vehicles and traditional cooking fuel, etc., etc. At the end of the day, these are responsible for increasing the air pollution in many parts of the globe, which is, again, impacting the most vulnerable of our people. So how can we successfully use technology to sustainably transition to cleaner energy sources? Can you give us some examples from your life? And I also have to say, while I'm on one end of the globe and it's late evening for me, for you, thank you so much for being here, because I know it's like 6 a.m. So thank you for being here. But tell us more about what you're doing, because it's absolutely fascinating.
I truly appreciate that. And before I launch in, want to say a very heartfelt thanks to the UNGCI, everyone here who's organized this type of roundtable. I think I might be the last panelist, and so I've had the benefit of listening to all these amazing panelists and CEOs and changers of the world. So I'm truly humbled and blessed to be part of this discussion, and I hope the audience is taking great notes and can implement amazing changes going forward. So thank you. And yes, I work for Tesla, and it is a big buzzword. What I want to impress, though, is Tesla is more than just big, beautiful, flashy cars, is what we think of. Tesla is more than that. I actually don't work with the cars at all, though I do respect what they do and what they're doing to help reduce greenhouse emissions and transition there. I work on the energy side. I work on energy deployment, and specifically on the commercial side. So let me take a step back and actually talk about Tesla. Even though the cars of Tesla are under that umbrella, the mission of Tesla is quite short and quite sweet, and is to accelerate the world's transition to sustainable energy. And so I have the privilege to work in this energy deployment sphere. So I'm thinking about what the other panelists have mentioned earlier today, and my colleague here, Dr. Abudo, and the keynote, Dr. Maheshwari, talked about access. Now, your last question talked about the last mile, and I'm thinking through the entire supply chain, and I want to talk about the first mile. The first mile, how do you get access to electricity, to energy, and furthermore to clean energy? that is the most important thing, because without clean energy and access to this energy, the beautiful work that everyone here is doing cannot be possible. We want to help provide clean energy to everyone in the world in order to keep critical facilities and critical technologies and development to keep going. And the work that I do at Tesla is actually managing a portfolio of projects that allow for that to happen. So what I do is install PV, photovoltaic, on commercial buildings in order to generate and harness the energy of the sun, which is what we call sustainable. It's never going to go away, even though, you know, we have some cloud cover and things like that. So we can generate sustainable energy. The second fold is we pair that with state-of-the-art lithium-ion batteries. And these battery systems have the capability to store this energy for future use. So it's so interesting to talk about how the world is interconnected. And in order to provide this type of energy, it's important for us to concentrate and direct our attention. And what we do is ensure this access for many people. So again, let's take the step back. Energy is the most critical necessity in the modern world in order to boost income of people all over the world, to increase employment, and at the end of the day, combat climate change. So going to your question now, how can businesses catalyze this transition to energy? So it's interesting, businesses account for approximately 2/3 of the world's end use of energy. 2/3. Think about that leverage power. So more demand for renewable energy brings economies of scale. It makes renewable energy cheaper and more sustainable options and better choices for the environment and human health. So how do we do that? How do businesses enable this? I think the first and most important aspect is actually shifting businesses' perspective. So when you think of a business and how to run a business, what are your operational costs? Rent, property taxes, overhead expenses, salaries, and of course, electricity. So what I believe is we have to shift the perspective of these change makers, these leaders, these CEOs in businesses big and small. And we have to think of energy not just as a cost of business, but as a strategic advantage. We need engagement from CEOs and government structures and stakeholders and boards in order to implement this actual critical value. Make it part of your priority. Make it part of your business's mission. Make it part of your vision. I think that is one of the most tangible and easiest thing to do, not at the end of the day, but easiest thing to reframe your mind. Say, hey, this is not just a cost to be managed, but make this a strategic advantage for my company, my business, my firm, my organization. And we live in the 21st century, and people use the power of their purse to support businesses that they believe in, that have values that are similar to their own. So I think that is the first way. The second way is through government advocacy. We need, Mr. Seiseker spoke earlier about the collaborating across business partners and the government. I think the most important catalyst for change across the world is to have policy change and to get buy-in from governments. I live here in America, but my colleague here I know in Kenya is working. Everyone here in India also needs to advocate to their governments. And again, businesses make 2/3 of the world's end use of energy. Leverage that power, work with the government. Tesla is a big organization, and we are grateful to have an entire arm that does government policy and advocacy change. But even small businesses can make small strides. If you're trying to relocate your headquarters or open up a new branch, speak to the government, see if you can get tax incentives and cuts and property taxes and things like that. Use that leverage power that you have. So an interesting stat that I'd like to tell everyone is that fossil fuel subsidies are one of the biggest financial barriers that are hampering the word shift to renewable energy. The IMF has calculated that there is about $5.9 trillion spent on subsidizing the fossil fuel industry in 2020. Think about that, $5.9 trillion in 2020. That is $11 billion a day. If we shift that, just that portion of fossil fuel subsidy to renewable energy subsidy, think of the power that we can have. So I go back to Dr. Prakash, who spoke earlier and very aptly mentioned what is going on in California and the massive heat waves. According to that goes hand in hand with the heat waves are big wildfires, shut down massive areas. But there are things and critical facilities that need to happen and to operationalize in order to provide healthcare to the community. And these are critical facilities. So in California, and actually the portfolio of projects that I manage at Tesla, we have a partnership with the California state government for what's called an SCHIP program. It is called Self-Generation Incentive Program. And I think it's a great model. It provides funding for areas of high fire threat and areas that are susceptible for utility power shutoffs because of massive heat waves and too much demand on the grid at once. But it also prioritizes low income and the medically vulnerable. So the projects that I install solar panels and batteries for actually concentrate on facilities that support community resilience. And those types of resilience are in many forms. We talk about sanitation. Sanitation, how do we have clean water and accessible water if water treatment plants are shut down, if wastewater treatment plants are shut down? We also need to have hospitals and elderly care facilities to be up and running and operational. And of course, schools. We need to have our children in schools. So the thing about this specific program is that it actually focuses and provides government subsidies for these types of installations that not just help the critical facilities, but the community as a whole. So that's the second portion that I think that businesses can use to catalyze this transition is government advocacy. The third I think is incredibly interesting and may sound a little trivial, but not. One of my previous panelists was talking about, Mr. Agarwal was talking about one of the positives that came out of COVID was the agency that women felt of being at home and able to manage work through telehealth or teledoc or even telecommuting, as well as their family life, and whether it's taking care of an elderly person or their family or their kids. And they created this beautiful sense of agency in women. Now women are asked to be going back into the workforce and they're losing that sense of agency. So it may be a small step, but it's actually at the end of the day, cumulatively can be a quite large impact for businesses to help encourage remote work. We have the technology to have teleconferences and to have this is a case in point meeting, this amazing roundtable of people all over the world. I am in America. We have my East Africa colleague over here and people all over India and yourself in Australia. We are able to bring beautiful minds together because of this use of technology. Encourage remote work. And so the reason I say this is because we have to tackle areas I've seen are the most contributor to climate change. And one of that is greenhouse gas emissions. So it turns out that greenhouse gas emissions from just transportation has accounted for 27% of emissions. That is a huge percentage. Imagine if we can cut that down by half. What can happen for the impact of global climate change? So these are different areas that I think that businesses can use to transition to renewable energy. And again, I'm so humbled by the work that my other colleagues here have presented the uses of technology and sensors and digital platforms and telehealth innovations. It's incredible, but without access to electricity and to energy, I think it would be it was an uphill battle. And it is my goal at Tesla to help provide clean energy to not just these companies and the 2/3 of the businesses around the world, but to every single person.
Brilliant. Thank you. Thank you so much. Really, really helpful. I mean, I think the point that you made about businesses are 2/3 of the world's end users of energy, and therefore they've got to look at energy differently. They've got to see energy as a strategic advantage, and they've got to see it as a priority. And they can't do that unless they collaborate somewhat with government. And the way they can really impact government is by policy and advocacy. It's pretty horrific to hear that there's $5.9 trillion of fossil fuel subsidies still existing in the world today. And that's something that really needs to be taken up. And if that could be shifted to renewables, it would make a huge difference. As would, as you said, remote working. That would bring down a lot of our energy bills globally. So thank you, Samira, for sharing all of that with you, with all of us. I think at the end of the day, what you said, which is that the sun is there and it's not going anywhere. And however we can maximize that kind of energy, and if we can find a way to store it, and it does look like lithium ion batteries are the best way to be able to do it, it could really be a game changer. So thank you for sharing that with us. I mean, I think we've heard from so many different people about so many different areas. We've heard about how digital's making a difference, how, you know, just in terms of the sensors, and about things like, you know, getting vulnerable people and the women to be able to do things and to be part of the solution, not just being victims of it, is fantastic. And that's certainly the way we need to go. So I'm going to end this by, before I hand over to Shweta to do the closing. We've really gone from the first mile with Samira to the last mile, I think, with IAPMO and Dr. Nimesh Shah. And we've got everyone else in between. But the miles don't matter if we're not alive. And the miles don't matter if we're not healthy. So we have to work together to solve this problem if we want to make sure that we've got generations there in the future. So thank you so much to all of you. And I will now hand back over to Shweta to do the closing.
Shreya.
Sorry. Shreya.
That's okay. Thank you so much, Ms. Thoria, and to all the panelists for such a thought-provoking discussion and about what companies can do to bring about this much-needed change. We wholeheartedly agree that it is through focusing and empowering the most vulnerable population, women, children, that we can address this rising concern of climate change and healthcare. And above all, it is collective action. It is focused on digitalization, moving with the 21st century, that we can actually cover the paces much more quickly. After all, we are in the decade of action, 2030. We do hope that we can collectively achieve the goal that we all set out to do. So thank you all once again for sharing the insights. It's actually very interesting what you mentioned, Samira. We have on this panel people from across the globe. We are actually covering the length and breadth of the globe. So more power to all of you. Now, before we end today's roundtable, I invite Mr. Asim Kumar. He's the head of Asia Pacific Resource Center here at UNGCNI to give the vote of thanks. Over to you.
Thank you, Shreya. I hope I am audible. So I think we have been very successfully able to achieve the very purpose of bringing this roundtable, global roundtable, into a reality. Because as I mentioned in some of my posts, that this particular initiative is not going to be a single set of events or something like that. We are very soon going to launch a health and well-being work stream, where we would try and get corporates on board and get them to not only bring funds, but also bring their resources, their experiences, their expertise, their capabilities, so that we can carry on the good work that we have learnt about today. And therefore, I take this opportunity to profusely thank Vandana, DP, Dr. Nora, Nimish, and Samira, because this panel also touched upon the various other SDGs. Digital can be a solution, fine, but if it doesn't reach the beneficiaries, what is the use then? And if we cannot provide access by providing energy, by providing electricity, by providing better roads or whatever it takes, then also the job remains incomplete. And it is therefore very, very good to have had listened right from the beginning to the end, the thoughts that really came from the DNA of the organizations, and we need to be leveraging that DNA to make impact, to scale up, and to speeden up. This is what we have in mind. And at UNGCNI, we are particularly working in areas like water and wash. We are working in the area of women empowerment and gender skilling and capacity building, and also sustainable agriculture and agri business. We also explored the various issues relating to use of technology in bringing change in the ecosystem that was discussed at large even today. So there is no two ways about acknowledging that yes, innovation and technology are definitely going to be the saviors, but aligning those with proper infrastructure, with proper distribution, with proper access is the responsibility of each one of us. And I am sure, together with the power that this esteemed panel has vested in us today, we will be able to take bigger and on-ground steps very, very soon, and look forward to your continued guidance and support. So from UNGCNI and of course the team, Mr. Ratnesh, Shreya, and other colleagues, really grateful that we could achieve a lot in 2.5 hours today. And that was my request also to people, to the participants, that health concerns everybody. And therefore, you must take out 2.5 hours of your time to invest in health. Thank you very much, and God bless everyone.
Thank you so much, everyone, for joining us. We hope to continue working together in this decade of action with a resolve to leave no one behind. Thank you once again. Good evening, good night.
Thank you. Bye.
Thank you. Bye.
Thank you, everyone.